This is Dr. Liz Geriatrics.
I think one of the things we enjoy the most is getting that family history and finding out, it's one thing to be eclectic and independent all your life. It's another thing to hit the latter years of our life and then begin to make choices that are unsafe. As you said, Dr. Lansford, a change in their norm as it might be. And how do you manage that? How do you mitigate that? I think the primary goal is to keep them safe and not have an adverse effect on themselves or others. Short of that, we want to make sure that we are mitigating the safety issues and respecting and celebrating who they are. You're absolutely right. If they will not take meds, it's always been their proclivity. We're not going to get them to take meds going forward. But if they had been fairly compliant previously and mindful and kept their house tidy and neat, and now it's a mess and they're refusing to do the things that may be working to their advantage, then we have to talk about different strategies and how do you put that safety net around them, still respecting the independence and the human being that they are. And we try to think outside the box and be a little bit we try to work compassionately with the grace of the individual at the forefront, but keeping that safety in mind and absolving the family of feeling as if they failed or as if their personal goal hasn't been met, even though their loved one's goals have been met. So we do a lot of supportive measures in regards to the physicality of the rest of the client and the individual, but also the emotional support of the family, giving them permission to know they've done their best and they may not win this battle.
Well, actually, that's a good point. It can often feel like, mom's staying at home, but we've moved away, and we would feel better if she was in an assisted living.
Yeah.
Well,
we would feel better.
Right. There's some people that I say, well, you're at high risk. You've had a number of falls. You're at high risk of breaking a hip. They're like, no, I'm not going to break a hip. No, I'm not going to have a stroke. And that's a little different. But at the same time, if someone is really unsafe, if they have left the stove on, if I've had elders, in a neighborhood who go out and search for someone at 11 at night to help them move furniture or something. It's like, no, that's not okay. And then you have to kind of figure out, well, how can we make this person more safe and still keep them as independent as possible?
You have to come up with those workarounds. That is what we are all about, are those workarounds. And I can't agree with you more. There is a fine line between capacity and lack of capacity, and how to mitigate the safety issues around that. Sometimes we can, sometimes we can't, and it is a deeper finesse. But if we can show the respect, be a bit creative, and take the family off the hook a bit for their guilt, their worry, their concern, I think we've done what we needed to do in many ways. And that's the joy of, I think, my side of the coin in supporting our seniors in these rural areas.
Hey, give the next video a watch. And don't forget to click like and subscribe.